The clock is ticking for millions of Americans. Subsidies for premiums through the Affordable Care Act are set to expire here at the end of the year.
Yeah, experts worry many people will drop their coverage because of the higher costs. NBC4's Christian Cázares is live in Ontario for us with the ripple effects this could have on our healthcare system. Christian.
That's right, guys. Today we spoke to a doctor who says his biggest concern in all this is the lack of preventative care and medication that people need and benefit from having that health insurance. Now, he fears that people will not be able to pay and drop their coverage and run to the hospital, to the emergency room to get that medical attention and walk out with thousands of dollars of debt.
Medical coverage for millions of Americans could soon come at a higher price, when premiums for those who fall under the Affordable Care Act will likely pay more in a few weeks.
It just feels like it's hopeless.
Emily Hanscom is scared of losing her medical coverage she desperately relies on, which also helps control her weight loss. If premiums hike, she says, she won't be able to afford it.
Being able to afford these premiums that are there on top of the price of groceries, on top of the price of rent, on top of the price of gas, car insurance, all of your monthly expenses is becoming overwhelming.
Last year, more than 24 million people received ACA enhanced subsidies that are set to expire at the end of this year. Open enrollment starts next month, where experts say costs could double or triple.
I'm extremely worried as a physician that those mammograms and also screenings are not going to be done, and also the medications that we need to make sure that our high blood pressure and our sugar are balanced are going to go away.
Dr. Shapiro with Altamed says people who can't afford the higher costs may drop their coverage, but seek the medical attention they require at the hospitals.
ERs are amazing, but they are there to actually help us survive and make sure that we are healthy to go back to the community. But they don't take care of the high blood pressure, colorectal cancer screenings, and other things that we have in front of us.
The issue has paused Washington now on day 23 of a government shutdown, where Democrats say they won't vote to reopen the doors unless the tax credits are extended, while the GOP says they won't negotiate until a clean funding bill passes. For this self-employed massage therapist, the future of her health care, she says, looks grim.
If I were to get sick, just a regular sick, and I didn't have my health insurance because I couldn't afford the premiums, I can't afford to go to the emergency room.
And medical experts that we talked to say now is the time for people to get those checkups, get those refills on those medications. But tonight, the reality for so many families facing those potential price hikes over the next coming weeks is unclear.